This person says, I've already had COVID. Why would it be important for me to get the vaccine?
Well, we know that COVID is changing, and we know that if you get a vaccine after you've had COVID, it helps boost your immunity. I think what's even scarier is that we learned from the CDC's Provincetown report 2 weeks ago that folks that are fully vaccinated can contract the illness and spread it to other people without knowing it. So if you've had COVID, but you know that you can make your immune system stronger by getting a vaccine, I think that's a great idea because you don't want to catch it and then give it to somebody else.
Yeah, especially unknowingly. All right, this person says, does the J&J protect me from Delta as well as the other variants, as the other vaccines?
Um, at this time, it's hard to say because we're so early on in the course of Delta and its progression. We still stand by the fact that J&J is recommended just like other vaccinations.
This person is saying, if I was vaccinated my third trimester of pregnancy, would my baby have antibodies? And if so, how long would those antibodies last?
So I think it's unlikely that the baby will have COVID-19 antibodies, but it's much more likely that the baby will be protected from COVID, because if the mother is protected from COVID, then it makes her chances of getting the illness much lower, and that thereby protects baby.
All right, and this question is, I received my first shot and then 2 days later I got COVID and was hospitalized for 14 days and they gave me steroids and other things. Do I really need to get the second shot of the vaccine?
I would strongly recommend that that individual be fully vaccinated. Again, we know that folks who have had COVID and then received the vaccine later have elevated levels of immunity. And for the same reasons I outlined before, we know that you can contract COVID and give it to other people after you've had it. So it would be really important for you, your loved ones, your neighbors, people around you, for you to be vaccinated so that you can protect everybody around you.
All right, so this person is saying they were vaccinated in February. They've taken several blood tests and there were antibodies at first, but now there are no antibodies. Do I need a booster shot? I'm a healthy but 85-year-old person.
If a booster becomes available, which we hope it would be available soon, I would recommend that that person have a booster, simply because at age 85, they are in a very high risk category. Right now, boosters are not recommended, or we don't have license from the state and from federal sources to be doing that on a regular basis. But if we get that recommendation from the CDC, then I would definitely recommend that that person get a booster.
This person's asking, are the symptoms of the Delta virus variant any different than regular COVID?
So far, we haven't seen a big difference. Again, it's early on. Most people are experiencing those same symptoms, shortness of breath, cough, fatigue. I will tell you that at Cone Health, we have seen an increase in the severity of the disease. And so I am a bit concerned that Delta is causing a more severe form of the illness. We've seen a relative increase in the total number of ICU patients that we have to treat this go round with Delta. So while the symptoms aren't different, the severity seems to be a little worse.
This person says they lost their taste and smell in October of 2020. Still haven't gotten it back. Is there anything they can do to get it back?
That's so tough. I hope they're following with an otolaryngologist or an ENT doctor, your nose and throat doctor. I don't believe that there's any formal treatment right now that's been proven in trials to bring the sense of smell back. However, in any situation like that, there could always be something else that's going along with it. And so I think it would be wise for them to first talk to their primary care doctor and then perhaps see an ear, nose, and throat doctor to talk further about it.